I'm George Friday. I'm the vice chair of the Southern Anti-Racism Network, and I'm part of the NC Medicare For All coalition. So good to see you all tonight. I'm glad you're here. We're going to have a wonderful evening of information about Medicare for All so that when you're having conversations with colleagues in your organizations, or in your neighborhood, your church, or where you work, you can give them great information about Medicare for All and why it's so vital. Some information about us.
Do you want to listen to it?
Sure.
Oh.
Hi, Marcia. You might want to mute. So, la coalición NC Medicare para todos la invita a Medicare para todos. Asamblea Popular, 27 Agosto 2020, 7 p.m. to 8:30 p.m. en vivo por Zoom y Facebook. Confirmar asistencia NCM4A.org, Medicare para todos. We hope that you can share that information with folks in your network, especially those for whom Spanish is the first language. Here's an idea of who we are. We are a coalition of many, many organizations. My organization, the Southern Anti-Racism Organization, is clearly about racial justice. But we all know that healthcare is a human right. It's a civil right. It's a racial justice right. It's an economic justice right. It's a peace and justice right. If you look at this list and all of the different kind of organizations that are here, from the Triangle DSA to Women's International League for Peace and Freedom, to the many healthcare groups, some groups that include providers and professionals, some groups that are full of activists. If your group isn't currently a member, please join. And you can do so at our website. We're growing and we're glad for you to be part of us because we have a lot to do. And we believe in these principles. This is part of what fuels our work, part of what we all agree about, part of what we believe in. Give you a few minutes to read that. Thanks, Stacy, for adding that the North Carolina Poor People's Campaign and Down Home NC are recent partners. We need to put them on our list. And please follow us on all of these platforms. Share, retweet, whatever the appropriate word is for the particular platform, please do that. I don't know what the square thing is with the orange and purple. It looks groovy, but I don't know what it is. Facebook, Twitter, Instagram, I bet. Yes, I'm gonna say it's Instagram. Yes, I am an old lady and I don't care. But please do all these things so that folks know about us. So, here you go. If you have questions this evening, please put them in the chat. Please put them on comments on Facebook, and we're gonna try to answer as many questions as we can. If we don't get to them tonight, please know that you'll find information through email or post it on our Facebook page or our website. So here we go. Starting out this evening, hearing from Rebecca. Oh, Rebecca. Rebecca, who is one of the folks that helped pull the coalition together and keeps us going. She works for NC Justice Center, I know that for a fact. And she's one of the co-conveners of Healthcare for All, y'all. Rebecca.
Thank you so much, George, and welcome everyone. Thank you so much for joining us tonight for this first Improved Medicare for All 101 Town Hall. Really excited to see all of you. Before we get started, we want to launch a poll just to sort of gauge where people are who are on the call in terms of their own experiences with our healthcare system. We've never done this before, so hopefully, there we go, yay. So please take a minute to look at the answers and answer that question, and we'll put the poll results up shortly. So wanted to put this discussion in the context of this mass misinformation campaign about Medicare for All that has been waged for decades, going back to Roosevelt, Truman, where you had health industry people that have been trying to undermine a national health insurance program that we, as you will see, desperately need. So that's what this is all about. It's about spreading real information, facts about this policy, so that we can counter the mass misinformation campaign. And one of the reasons we know so well that this is actually happening is because Wendell Potter, who was on our first digital rally, he is a former health insurance exec who turned whistleblower. And he talks about that our propaganda duped Americans into believing that the free market can work in healthcare and that progressives want a government-run system. We'll talk a little bit more in a little bit about what we actually are asking for, but that is a big problem, that this misinformation campaign is out there. And in fact, one of the groups that is doing that is called Partnership for America's Healthcare Future. It sounds so innocuous. It sounds, wow, they're really looking out for us. But the truth of the matter is they are health industry group. They're made up of like the insurance companies, pharma, all the medical device companies, hospital systems, and they are putting lots and lots of money into the election, into advertising to kill Medicare for All. And in fact, even killing the public option, which we will talk about later, is not even something that's going to fix the problems in our healthcare system. So remember, this is all couched in this mass misinformation campaign that we are going to completely debunk with real facts. So even before the coronavirus pandemic, the United States was experiencing a healthcare crisis. COVID-19 has highlighted the need to create a universal system with no cost barriers to care. So what is our current system? It's expensive, inefficient, unsustainable, and it's not working for most of us. The US healthcare system is the most expensive system in the world. In 2018, we spent $3.65 trillion and about $10,209 per person, so per capita. So as you can see, we have a bunch of other countries, developed countries under there. We spend almost double what other countries spend on healthcare. Yet, millions of our people are without adequate health coverage. So before COVID-19, we had 87 million people, or 45% of 19 to 64-year-olds were either uninsured or underinsured. What is underinsured? Underinsured are people that actually have insurance but can't afford the out-of-pocket costs. So they can't get treatment, they can't see their provider because they can't afford the copays or the deductibles, something like that. And that is sadly a lot of people, even before COVID-19, were underinsured. And in fact, more people with health insurance were underinsured in I think it was 2017 than were in 2010. And the highest increase in underinsured people, again, this is before COVID, were people with employer-based plans. But here I thought we're supposed to love our employer-based plans. Sadly, over the years, employer-based plans have actually gotten worse and worse, as have the marketplace plans. And more of the out-of-pocket costs have been shifted to the employee or the consumer, which is, of course, how the insurance companies look at us as a consumer. And the question that comes up now during this pandemic is, how reliable and effective is employer-based insurance when millions are laid off during a public health crisis? So Families USA said that this pandemic and the economic crash have caused the greatest health insurance losses in American history. And sadly, we're seeing it all around. Millions and millions of more people now do not have insurance or are trying to struggle with getting marketplace plans or COBRA or all of these different things. And in the middle of a public health crisis, that's exactly the time you don't want people to be uninsured. So just when we need it the most, our employer-based system is showing that it's an abject failure. So there's a lot of lies that the industry has put around as part of this misinformation campaign. So we're going to try and attack some of them. So one of them is, we have the best healthcare system in the world. Of course, we have heard this. The truth of the matter is our outcomes, many of our outcomes are actually worse than in many other countries. We have a lower life expectancy than a lot of our other developed countries. In fact, not last year, but the 3 years preceding, our life expectancy went down for the first time. So for 3 3 straight years. We actually have the worst maternal death rate in the developed world. Yes, the worst maternal death rate. Our women are dying in childbirth or the year following childbirth at higher rates than other developed countries. Same thing, sadly, with our infant mortality rates. And of course, horribly, we are experiencing catastrophic and unacceptable racial health inequities. So talking about the maternal mortality rates, African-American women are more than twice as likely to die than their white counterparts during that pregnancy or the following year. Same thing, sadly, with the infants. The statistics for Black babies are really horrible. And then there's other metrics: high blood pressure, diabetes, stroke. Pretty much every metric you can think of, African Americans fare worse in our healthcare system than their white counterparts. So why is that? Of course, it's a consequence of centuries of underinvestment, lack of access, and of course the biggest one, which is the systemic racism, which we have to dismantle. But what happens? So now we're in this coronavirus pandemic, and the Black and brown communities are being assaulted. They are actually getting more cases of COVID and dying at a higher rate, disproportionate to the numbers they have in our population. So that is also part of what's going on with our system today. Also, our wonderful, great healthcare system is a for-profit system that's forcing our people to beg strangers for money to cover the costs of necessary medical care. I'm sure most of you have given to GoFundMe campaigns. Hopefully, not many of you have had to actually put one up, but sadly, this is what we're doing. We're forcing people to beg people for money. 1/3 of the campaigns on GoFundMe are to cover medical expenses. We are also the only developed country that allows its citizens to go bankrupt because they got sick or had an accident. So about 2/3 of people who file for bankruptcy cite medical issues. Many of them are insured. Once again, this is getting back to that underinsured. Many of us have insurance, but we don't even realize that we're underinsured because everything is so complicated. And then if we get sick, we're left, with all of these surprise bills, and that can lead to bankruptcy. And sadly, research shows that the implementation of the Affordable Care Act has really not improved things. So overall, our healthcare system is just bad for our economy, for our country, and it's actually also bad for our businesses. It hurts the bottom line, hinders strategic planning, creates a competitive disadvantage in domestic and global markets. And Charlie Munger, who is the vice chairman of Berkshire Hathaway, certainly not a liberal in any way. I love his quote: "Our cockamamie system gives our companies a big disadvantage in competing with other manufacturers." So bad for business. So how did we get here? We got here with policies that were passed by people that favor privatization, corporate greed, and profits over people. So we have a commodification of our healthcare system in the US. So private insurers increase profits by denying care. In the process, they redirect billions of dollars away from healthcare services to shareholders, salaries, advertising, lobbyists, campaign contributions. So we are actually paying private insurers to restrict our access to care and stand in the way of providers and patients making decisions based on health. See the problem? There is somebody. Why are we allowing for-profit middlemen to come between us and our doctor? And of course, one of the great lies that came out when the ACA was being enacted was death panels will be rationing our care. Of course, the US already has these death panels. Insurance pharma, PBMs, which is the pharmacy benefit managers, they're denying us doctor-prescribed care so they can make profits. So in some ways, we have the most ration system in the developed world because our bank account and our zip code determine our health outcomes. Also, our private insurers are profiting from public dollars. Not sure how many of you know this, but over the years, the for-profit insurers have lobbied Congress to quietly privatize Medicare and Medicaid services. You might recognize the name Medicare Advantage or what's going on in North Carolina right now. Our Medicaid is now being transformed to a Medicaid managed care system, which is basically the privatization of these services. So public dollars that are intended for care are landing in insurance company profit margins. So again, the Center for Medicare and Medicaid was able to administer these services for a minuscule administrative cost, like 1 to 2%. And now, sadly, we are giving that money to for-profit insurers to manage these. And I know some of you have heard like, oh, but Medicare Advantage plans, you can get them for free. Yeah, they might be free to you in terms of you know, premiums, but those insurers are getting paid, and they're getting paid with our public dollars that could be used in a better way, in a more efficient way. So this just blew me away. Over a period of only 6 years, the top 5 for-profit insurance companies more than doubled their revenue from Medicare and Medicaid, and now 59% of their revenue comes from them administering those 2 programs. So we always hear that seniors love Medicare Advantage and Medicare recipients will get worse care than they have now. The truth of the matter is that Improved Medicare for All covers much more than traditional Medicare does today, and there's no out-of-pocket costs. So Medicare has an 80-20 split. That will go away. No copays, no deductibles. And it will also be improved to include vision, dental, hearing, long-term, and home health care. And of course, we know another big problem with our system is Big Pharma is just absolutely ripping us off. The US completely overpays for prescription drugs. So many of us have read the horrible, horrible stories about people rationing their insulin and end up dying because of it, because that is not something you can do. My dad is a diabetic. I've seen what happens when he has low blood sugar, and it's a travesty that we're allowing pharma companies can price gouge whenever they want. If they decide tomorrow to jack up insulin even higher than it is, they're totally able to do that. So your money or your life, that's where we're at with Big Pharma. One of the industry lies about the pharma companies is innovation will stop if there's no profit motive. The truth of the matter is pharma companies spend more on sales and marketing than they do on research and development. Also, a lot of research and development is actually done with public dollars at public universities and public hospitals. So we put the bill at the front end, then the pharma companies come in and they do pay for clinical trials and things like that. So there is an investment, but a big part of the investment is already public dollars. And then they are able to price gouge us on drugs that we helped to develop. So wouldn't we be better off as a nation if profit were not the motive for innovation? Yes, I would say we would be. The wonderful thing is we are all here to talk about Improved Medicare for All. This policy that this coalition, this North Carolina statewide coalition, is promoting. It is amazing policy, and the more you look into it, the more you will see that it is absolutely the economic, the moral, and the public health answer to our public health care, to our healthcare crisis. So, and also we're already paying for it, literally. It is a sustainable and fiscally responsible way to pay for healthcare. So if you look to your right, that is our current multi-payer system. It is a chaotic system that is filled with bureaucratic inefficiency and waste. We have, in some cases in hospitals, more administrators than we do providers that are having to deal with the billing side of things. Then you also have all the administrators in the insurance companies. So we have massive administrative costs with this private for-profit system. And it ends up that private companies are making decisions about our healthcare based on their bottom line and not about medical necessity. The wonderful thing is Improved Medicare for All is super simple. If you look on the left side, it's literally single payer. Single payer, which simply means one entity is responsible for paying our medical bills. That's all it means. So say we have the Center for Medicare, all the bills will be paid through administrators from that entity. One single payer. It takes, and then important medical decisions are left up to healthcare provider and the patient. Another wonderful thing about Medicare for All is once enrolled, you never have to choose a health plan again. I don't know about the rest of you, but I would be happy to never have to go to the marketplace again and try and wade through these confusing plans and try and figure out which plan I can afford that won't give me the highest deductible. So Improved Medicare for All is also incredibly comprehensive. So when we're talking about Improved Medicare for All in the coalition, we are focused on a bill in the House called H.R. 1384, the Medicare for All Act of 2019, introduced by Pramila Jayapal in the last Congress. So what it does is it covers all U.S. residents from birth to death. It eliminates all out-of-pocket costs, so no more premiums, copays, or deductibles. It expands coverage to include dental, mental health, hearing aids, vision, prescription drugs, home health care, and long-term care. It has cost controls measures in there like global budgeting and being able to negotiate pricing for drugs and medical devices. There's substantial investment into medically underserved areas, understanding that we need to create a more equitable system, and that means that we need substantial investment in places that have been traditionally underinvested in. And this is one of my personal favorites, and drug patents if the companies continue to price gouge, which is totally in the purview of the government to do, which is wonderful. So how to fund it? We eliminate those unnecessary costs like I was talking about, all those administrative costs. We lower expenses by being able to negotiate for equipment, drugs, and medical device, and negotiating bulk prices, and we use money we already spend. And we can also do a progressive tax system that would actually be fair and equitable to people and not put the majority of the burden onto people that don't have the money. So there's been a recent comprehensive study done by professors at Yale and published in The Lancet in February of 2020 that taking into account both costs and savings. The Medicare for All Act, a single-payer universal healthcare system, is likely to lead to $450 billion in savings annually. It can be funded with less financial outlay than is incurred by employers and households paying for healthcare premiums combined with existing government allocations. So less money than what we're spending overall. This shift to a single-payer healthcare system would provide the greatest relief to lower-income households. So what I was just saying, that lower-income households would have the greatest relief. They would be paying less than they're paying now by a lot, and that would really, really help. Ensuring healthcare access for all Americans can then also save more than 68,000 lives a year. 68,000 lives a year that we are potentially losing now because people cannot get to the doctor when they need to, and then their conditions get worse. And of course, the other thing is when you can't get to a doctor and your condition gets worse, you oftentimes end up in the emergency room. The emergency room is the most expensive healthcare you can get, and then most people can't pay that bill. And that turns into what we call uncompensated care, which is really difficult for the hospitals, and it leaves people in financial debt. The whole way we're doing the paying for this system is completely backwards. So of course we always hear, but it'll cost too much. This system, it's just going to bankrupt us. Well, 100% of nonpartisan studies found that single payer controls costs. Very much like that Yale study, there's several others. And by the way, we have a lot of resources up on our website, which I'll bring up again. And so you can find a lot of this. Also, we have a lot of we have the PowerPoints and they have the sources, so you can click on them and check it out. So even a Koch-funded Mercatus study, so it's a libertarian think tank, a couple Julys ago in 2018, did a study, and they even found that single payer saves money, about $2 trillion over 10 years. And you know they did not want to find that, and yet they did. So one surefire way to save money is to take the profit motive out of healthcare, which will lower costs for everyone and help us pay for it. Why are we okay with insurance executives making millions while regular people are facing financial ruin because they got sick? And then one of the things that has come up during this pandemic is that major US health insurers report big profits. They're benefiting from this pandemic right now. So while Americans are putting off going to the doctor because of costs, even if they have COVID-19 symptoms, insurers are making record profits. So why hasn't Congress fixed this? Sadly, that is because of lobbying. Healthcare and insurance industries are mobilizing to kill Medicare for All. Tied into how we started this with the mass misinformation campaign, that's one way they do it. The other way they do it is by buying our policy.
Hey, Rebecca, could you slow down a tiny bit? Someone asked.
Oh, sure. Thanks. So it unfortunately is a bipartisan problem. Campaign contributions from the healthcare industry, from the insurance industry, helped to push forward the ACA, which didn't have a public option, and single payer was not even allowed to be on the table. I often talk about how during the hearings for the ACA, they did not even allow single payer activists to testify in front of Congress. And the Democrats were had a supermajority in both the House and the Senate. And they did not allow single-payer activists to testify. And in fact, they were arrested trying to get the word out about single-payer back then in 2008. I call this legalized bribery. You can call it what you would like, but it is sadly the system that, even though this policy is incredibly popular, despite what we're being told, a recent poll found that about 87% of Democrats supported this policy, 69% of independents, and even 42% of Republicans support this policy. We're still not getting movement on it. So, which leads to talking a little bit more about the public option or shoring up the ACA. Many of our politicians like to say that, oh, well, you know, we can't do Medicare for all, but we can improve the ACA and we can, you know, institute a public option. But preserving any aspect of this for-profit private health insurance perpetuates the problems that we already have. So cost driven by profit motive that benefits shareholders and CEOs and not the people. It still remains wasteful and inefficient because the public option is only one option in our multi-payer system. And one of the ways that we get savings is by cutting the administrative cost by going to a single payer. So therefore, adding another option you know, to this system will not get the cost savings that we need. There's still, we still also have all the bureaucracy and the craziness that is involved with the system as it is now. So changing rules for pre-authorizations, facilities and networks, decentralizations mean we still can't negotiate for equipment, devices, or medicine. And we still have these out-of-pocket costs, these cost barriers to care, which keep people from getting care when they need it. The other thing, now working in healthcare advocacy on a professional level, it's so easy to see how insurance companies manipulate things. So insurance companies would be able to manipulate this system and put the sickest patients into this public option, and that would make it expensive and unsustainable. And they could say, oh, see, we told you, private for-profit insurance is much better for our country than this a public system. So gaining the public option would require a huge amount of political capital. Let's not kid ourselves. It would be a major fight on our hands just for the public option. And in fact, the Partnership for America's Healthcare Future is actually attacking the public option as well. So they don't even want that. And it wouldn't fix the problem. So why would we spend all that political capital and not actually fix the problem? Because again, COVID-19 has shown why it is essentially important that we have a functional, universal system with no cost barriers to care. Just going to go through just a few more of these lies. So people in single-payer countries wait months for care. Wait times are already long in the US and never end for people who can't afford to get care. We live in Chapel Hill, North Carolina, which is right next to UNC. My mom had to wait 5 months to get an appointment with a neurologist, 5 months. Wait times are caused by too few providers that are, or systems that are under-resourced. It's not about who pays the bills. And of course, just as federal action has created and funded community health clinics in underserved areas, it can create policy to meet the needs. So once we have this foundation of this system that covers everyone, we can then create additional policies that will address the different issues that come up. Here's one of my favorites. I won't be able to keep my doctor. The truth of the matter is the Medicare for All Act of 2019 gives us more choice because we are free to choose the providers appropriate for our condition and our location. I don't know about the rest of you, but in my insurance, I have a limited network. I can't go see any doctor that I want to see. So say the specialist that I need is not in my network. I have to get on the phone with my insurance. I would have to beg them. This system, none of that. If there's a doctor that you need and they are in this one big network of systems, and you will be able to see them with no cost, no cost. Could you even imagine not having to take your wallet out, not having someone coming up to you with that cart or asking you about your insurance information? It's almost too much, can't believe it. So no more networks, and it crosses all state lines. Another one, doctors will get paid so little they won't be able to make a living. HR 1384 establishes a physician consultation review board to review quality, cost effectiveness, and fair reimbursement of services. The truth of the matter is, why would we create a system that our providers wouldn't want to be in? That is a scare tactic, and I'm completely confident that we can get a reimbursement rates that would actually still allow our providers to make a good living. So, and of course, doctors would actually be able to focus on their patients and not endless administrative work, which leads to serious doctor burnout. Here's another one. Insurance workers will have nowhere to go, or we can't let our insurance companies just disappear. This is illegitimate. There's a lot of people that work in our insurance companies, but HR 1384 also addresses that. It allocates money for the first 5 years to assist displaced workers. Providers working for insurance companies can actually return to caring for patients and not having to deny people care, which I have to say would just be soul-sucking work. I don't know how they do it. So now is the time to fight for healthcare justice. Join us. That is our website, www.ncm4a.org. And we have a ton of awesome educational resources on our website as well, at www.ncm4a.org/resources. So we are going to shift over.
The poll results?
Oh,
we get
yeah,
the poll
please.
results?
Yeah, go ahead. Wow. So luckily, it looks like we have a lot of lucky people on this call that haven't had problems affording healthcare, which is a wonderful thing. But there still are many people that have had issues with this.
So now we get to hear from our set of esteemed participants who are going to answer the questions.
Yes.
And thanks to everyone, because I noticed in the chat lots of great information being shared and some questions that came up. So Hannah, will you read some of the questions and assign them to our resource people for answers?
A lot of people have been sharing some really great resources in the chat to answer some of those questions, but one of the things that have come up is about out-of-pocket costs, and I was wondering if Dominic would want to answer that. People are asking how out-of-pocket costs would work with a Medicare for All system, as people know that with current Medicare for All, or current Medicare, sometimes there are out-of-pocket costs still. And so could someone, Dominic, would you share about how out-of-pocket cost would?
Dominic's in the car. Be careful, Dominic.
All right, I got it. So out-of-pocket costs, I know you might probably heard, like during the debates, Bernie Sanders said nobody would pay more than $200 out-of-pocket costs. But that was mostly for prescriptions. But seeing a doctor, you wouldn't pay anything out of pocket. There are no such thing as co-pays. There's no such thing as deductibles. There's no such thing as a minimum or a maximum amount that you have to pay. Everything is coming out of your tax, coming out of your payroll taxes, generally speaking. So there's, when you go see a doctor, there's no payment at the point of use. You might pay $200 at max for your medications over a year, and that's for people that are like the most wealthiest of people, or people that are on like maybe a lot of different medications, but even then there's still some subsidies that are provided. So most people won't have to pay anything for any kind of health coverage. But so far as elective surgeries go, not necessary elective surgery like a cleft palate or maybe something that might need to be taken care of that may not be medically necessary, but it's considered necessary to be a member of society.
I think we might have lost
Elective
Dominic. Oh, he's
surgery
back.
should be covered, and plastic.
Right. Thank you. And then another comment, a question that's come up a lot is about what the impact would be on healthcare providers should Medicare for All pass. And so, Jason, would you answer kind of a perspective of both concerns and what you see as the opportunities for Medicare for All from a health provider perspective?
Sure. Yeah, really quickly, just want to thank Rebecca for that great presentation and everybody who organized this panel today. And again, I'm Jason Sonnenschein. I'm a PA, worked in publicly funded medicine my entire career. And yeah, I mean, I am a big supporter of Medicare for All in no small part because of my experiences, you know, being a healthcare provider with low-income folks. You know, it is providers and patients don't want to have to think about how much medicines cost, how much procedures cost, how much imaging costs. You know, if the patient is going to be able to come back for follow-up appointments with the frequency that you'd like based on the cost of office visits. Those are headaches for the provider and the patient. You know, it's very stressful for all parties involved. So it would be great to, you know, have a system where that never even entered into a discussion about your plan with the patient for, you know, to manage their medical problems. I don't know, I hope I'm not jumping the gun too much, but also, you know, sometimes you hear folks say that a Medicare for All system, you'll just see basically every medical practice, you know, turn into cash only concierge. And I mean, we can look at other countries that have implemented some similar systems in the past 50 years, and we know that that hasn't happened. You know, we also know that the kinds of, you know, boards that would be deciding on reimbursement for like office visits or procedures would be mostly made up of medical professionals who are not going to, you know, set these kinds of prices at, you know, ridiculous rates that are going to make practices close. They're going to use evidence to do that. So I think that's kind of just also a scare tactic when people say that, but I'll let someone else talk.
Thank you, Jason. Elaine, would you also like to share your perspective as a provider of the impact of Medicare for All? I think you're muted. Thank you.
Hello.
There you are.
Hi. I would also like to congratulate Rachel. I'm sorry, Rebecca, on doing such an excellent job of giving us an overview of the problem. She hit on all the important spots, and I really enjoyed hearing from her. I think as providers, I think that most providers would be very satisfied with Medicare for All. One thing, it would take some of the administrative burdens that we have on us now off. And one of the biggest burdens for a lot of us is when you have a patient that you have worked with and they need to have certain medical care, and then they don't have insurance. And then they have no way of getting the care that you've recommended for them and you know that they need. So that's a problem for me. And I'm sure that other physicians are having the same issue, because a lot of times if people don't have insurance, even if they have cash, some places will not see them. And I don't understand that, but that's the way our healthcare system works in the United States. So I think for some physicians who are making a big haul, which, you know, is not the typical physician these days, most of the primary care providers are not overcharging and getting overpaid. I think that group would probably do well under this system and probably do better than what they're doing now. But so I would say a majority of physicians, I would think, would be very well satisfied with Medicare for All.
Thank you, Elaine. Rebecca, would you speak to the concern that comes up pretty often about how if Medicare for All or a single payer system was implemented, that there could be longer wait times, and people like to refer to Canada?
Yeah, so once again, I refer you to Wendell Potter. He actually just had a epic tweet thread about this. That was one of the biggest things that they worked on, was they cherry-picked anecdotal stories from Canada and created a mass misinformation campaign about these wait times. Like I alluded to in the presentation, wait times are not about how healthcare is paid for. It's about how many providers there are per the population of people that are there. So it's about how many resources. Yes, is the money, or are there enough providers for the population that that hospital, clinic, doctor's office is serving? That's what wait times are really about. And the truth of the matter is we have really long wait times here. I've heard over and over people talking about waiting months to get in to see certain specialists here. Like I mentioned, my mom had to wait 5 months to see to get an appointment with a neurologist. And we live in a place with, you know, one of the top hospitals in the state, and we still couldn't get in. So that's the deal with wait times. Check out Wendell Potter's Twitter thread about this, and see how it was all part of trying to make us afraid of this policy that will vastly improve our system and save people's lives.
And I would like to add that you can ask the person who has no insurance about their wait time.
Thank you, Rebecca and Elaine. Dominic, would you answer a question that has come up about the concern of workers that may lose their jobs should Medicare for All be implemented as a number of people work within this system? And I know that you do a lot of work around workers' rights. So the question is, how would, what would be the impact if Medicare for All was put into place that displaces current workers that are part of the insurance system or administrative systems?
Well, so far as the top dogs, I'm sorry to say they're going to be out of a job. So we won't need them. But for every one of the workers, for the people that really make sure the insurance companies do what little good they do now, they will have first dibs on any jobs that come up as in familiar job, Paul's bill and Bernie Sanders' bill. They get first dibs on any jobs, which would be needed because what you're doing is taking the most popular healthcare insurance in the country and you're expanding it to cover everybody. So there are going to be plenty of jobs opening up for people to get into them if they still want to go into that industry. So there will be, they luckily will have first deals on those jobs. So, and with it covering everybody, there'll probably be more jobs opening up in the U.S. market due to the way that we're going to give everybody health insurance.
Thank you. Jason, would you speak to how Medicare for All is important in this election cycle and what impact it'll have on the election this year?
Whoa, I don't know if I can speak to that. I don't know what effect it will have on the election this year because it's not really on the ballot, at least in the presidential election, which, you know, is the big prize. But you know, definitely down ballot, we are seeing you know, more and more progressive candidates running on Medicare for All, who understand that this is really the very best solution to turning our healthcare industry from, you know, a system that very reliably makes a few people very, very rich, and sometimes delivers healthcare to everyone, but usually not, to a healthcare system that routinely delivers healthcare to everyone. And as Rebecca talked about in her presentation, Medicare for All is extremely popular, not just with Democrats, but also with a large majority of independents, and even very surprisingly to me, but even, you know, in different polls, anywhere from like 20 to 45% of Republicans.
I got word from Stacy that we're going to do another poll. Oh, am I reading the poll? Or George, you got it? You're muted.
All right. Sorry, I keep muting and then unmuting and muting myself again. Regarding your health insurance, would you say that you like your health insurance, that you struggle under the cost burden of your private insurance, you feel overcharged, and you'd feel like you've been treated unjustly by the private insurer, you have Medicare and Medicaid, or you're uninsured? Let's see what we have to say, people. Dang, it went away quick. All right, then. I ain't in that one. You're on your own. Oh, thank you very much, Stacy.
Can I jump in and say one other thing about the election? I think also the impact of Medicare for All in the election depends on us. That's what this is all about. That's what this coalition is all about. We need to be loud and powerful around this issue. We need to lay out the facts, talk to all of our elected officials, people that are running, because guess what? A lot of them don't understand this policy or pretend they don't understand it, and that's where we come in. So we have to push our elected officials and our candidates on this issue, and we have to then hold them accountable once they are in office.
These results are very telling. No one's really happy. Guess you guys that have Medicare, Medicaid are. But a good almost 80% of the people that took this poll are like, this costs too much, I can't handle it, or I feel like they are using my ass. So not a Zen place to be. So be loud and strong, as Rebecca was saying, in terms of making demands, not requests. No time to be polite. This is time to be strong, loud, and demanding of justice for everyone. Other questions? Hannah, Stacy?
We do have a few more questions. Elaine, would you speak to this question that we have about if it would be better to try and implement Medicare for All on a state level before the federal level? You're muted again.
I would say an unequivocal no. I don't see states taking that role on. And we look at what has happened with the states as far as Medicaid expansion. We still have a pretty solid block in the South that have not expanded, and we have large numbers of people who are uninsured and need health care and don't have access to it. So I would not trust the states. This needs to be a federal mandate. And I don't see any other good way to do it.
Great, thank you. There's another question on here that some people may have, that I don't want to pay for other people's healthcare, only want to pay for my healthcare. And as a person involved in this movement, how would you respond to that? Rebecca, would you answer that?
Happily.
Or Dominic? Or maybe he waved at the camera.
Oh, Dominic, go ahead.
Did you wave?
Yeah, I did. If you understand how insurance works, you already understand that you're paying for everybody else's health care anyway. That's why health insurance companies go out their way to get healthy people who most likely won't need to use the insurance that they're paying for. The health insurance is basically all of us putting money into a pool, and whoever is needing of any health emergency can draw money from that pool while paying their deductible, while paying a premium, while paying an out-of-pocket maximum and co-pays, as the current system is. They're all going to that pool, and that's what you're pulling from. So what Medicare for All is doing is taking the United States and turning it into that single insurer, turning into that pool of money that everybody can draw from in case they have a healthcare emergency. But it expands it to everybody, so everybody puts into the system and everybody can draw out, versus the system that we have now, which overcharges you to put into a system where because you aren't just paying for people to have health care, you're also paying for the jets, the limos, the Porsches, the expenses of those millionaires and billionaires that run these healthcare insurance companies. So you're not just paying for the system that we have now, you're paying for other people's health insurance, and you're paying for their little girl's new Porsche on her 16th birthday. For a Medicare for All system, you'll be paying strictly for health care and the administrative costs for people that go to work every day like you and me.
If I could just add something, the other piece is that people that go to emergency rooms, like I mentioned earlier, that can't pay their bills, we're paying for that as well. All of our healthcare costs go up because people don't have coverage, and they so we're still paying. We're just paying for it indirectly, and we're paying for it in the most inefficient way possible. And like COVID-19 has shown us, if we are only as safe during a contagious pandemic as the least insured person amongst us. So just from a public health standpoint, you know, it's selfish and ridiculous to say you don't want to pay for someone else's healthcare. We are all in this together.
Thanks. I think we have time for maybe one more question and then final action steps. Jason, could you speak to how COVID has really highlighted the need for Medicare for All?
Well, I mean, obviously, you know, we've had, numbers are escaping me right now, but a huge number of people lose their jobs and with it their health insurance, you know, since the pandemic started. And I think that has really highlighted to a lot of people just how insane it is to tie insurance to employment, as if it weren't already. But you know, it's also, you know, shown us a lot of the racial health disparities that we have. Black and brown people dying at much higher rates from COVID, you know, and that's due to a lot of different disparities that we have in our society. But one of them is access to decent health care and the knowledge that you can go to the doctor without, like, you know, losing all sense of your financial stability. So yeah, I think that, you know, the pandemic has kind of uncovered a lot of these injustices that you know, a lot of us already knew about before the pandemic for a much larger portion of the population. And really quickly, going back to the question about, should we do this on a state level or a nationwide level? Another place where having a, public national healthcare system makes sense is in public health planning for things like pandemics, right? There's a reason why the US's response in comparison to some other countries could be seen as shoddy, and I think that is an issue that we don't invest in public health to nearly the degree that other countries do, and I hope that a Medicare for All system would have that piece of it as well.
Great, thank you. And I realized that we scheduled this event from 7 to 8:30, so maybe we have a time for a few more questions if people are feeling it. Dominic, could you speak to why Medicare for All is not equivalent to the public option, or Medicare for All who want it?
Well, public option still keeps the insurance companies that overcharge us for our health care in business. And what they're going to do if a public option or Medicare for All who want it is just another way of saying a public option. If that does go into effect, what insurance companies are going to try to do is unload all of their unhealthy patients onto the government system in order to say that it doesn't work, in order to try to overload that system and collect all the healthy people to gain higher profits. It's just an inefficient way of doing healthcare. I mean, a public option, largely we've seen some of those healthcare providers come out and say that they're kind of scared of even that, because they know that the charges will be cheaper. They know that it'll end up being a better option for most people to go, especially since you've seen millions of Americans losing their jobs. Most Americans can't afford a $400 emergency. The average American is living paycheck to paycheck. So a lot of people may choose that cheaper option, and it might actually drive down the cost, but it's going to take too long, and it's going to give them too much time to come up with a counter narrative and a certain type of way to defeat that system if it's ever implemented. It's not really the way that you will want to go, as a government option is overwhelmingly better. We can look at every country around the world and see that compared to our system, their systems kill us on every measurable metric. So keeping those for-profit health insurance companies in the loop will only allow the system as we have it to persist as bad as it is.
Thank you, Dominic. Elaine and maybe Rebecca too, you can both give an opinion on how do you respond to people when people ask you about Medicare for All and the concern that it would create very large government and government control into their health care? How do you respond to that?
Well, I remember when we were working for the ACA, and because we wanted to try and get health care to our citizens as soon as we could, and that's what we had on the table. And there were people saying things like, I want government to get out of my health care, and I don't want them to be invading my health care. And to me, it was ridiculous, because some of those same people were already on Medicare. And so, they already had a single payer government run health care and didn't realize it. And as a provider, I know that the insurance companies are really the ones in between us and our patients. You cannot make a decision to bring someone in the hospital and do certain procedures without getting it approved by the insurance company. So it's not government so much as it is the insurance companies. And so we have to just do a better way of educating the public as the games that are being played and the misinformation that is being fed to the people, because they, you know, the ones who are already on Medicare, they really like it. But, you know, because they've been misinformed, they are going around saying that we don't want any government sponsors health plans.
And I will just add, what we're talking about is publicly funded and privately delivered. So like Medicare is right now, especially people that still have the traditional Medicare and not Medicare Advantage, you know, you go to a private doctor. You're not going to a doctor, you know, you can go to whichever doctor you want. Medicare probably has one of the biggest networks of any insurance. So yeah.
Great. Thank you, Elaine and Rebecca. Could we respond to how could I become more involved in Medicare for All work? How could I get involved in the coalition? What action steps could I take? Maybe even right now. Rebecca, would you like to share that?
Sure. Let me start this slideshow. Is this the right one? No, it's not the right one. I thought that was, oh, yeah, it is. Okay, let me just start from here. Okay, so one of the ways is you could once again go to our website. I know we keep pushing our website, but it's really awesome. So many people have done such a great job of really getting it full of information, really incredible information and resources. But one of the things we have on there is a congressional letter, which is pushing for the Healthcare Emergency Guarantee Act, which is something that could help right now to cover people during COVID who have lost insurance. It basically would empower Medicare to cover anyone who is uninsured, but also cover all out-of-pocket costs for people with private insurance. So we have started this letter to try and push that out. We have 822 co-signers for it already, so you can sign and share. It's at www.ncm4a.org/campaign. If you want to join the coalition, we are now on the first Wednesday of each month. We will host a coalition-wide meeting. Please join us if you are one of our coalition orgs. We would like to have at least one member from each org there, or if you just are an individual that wants to get more involved or find out more information. So that's going to be September 2nd at 7 p.m. And if you are interested in, we're going to send out the Zoom link via our Google Group listserv. If you're interested in getting on that, please email the ncm4a.info@gmail.com and just tell us you want us to add you to your list, to our listserv. Okay, take action for Medicare for All. Join National Nurses United. National Nurses United, an amazing union based out of California that is also across the country though. They are doing a day of action around Medicare for All on Saturday, this coming Saturday, the 22nd. So add to the growing momentum. You can write a letter, make a call, request a virtual meeting, send some tweets, tag our folks. You can actually, a lot of people are doing chalking or posters and then putting them on social media. So there's a whole range of things that you can do to be part of that day of action this Saturday. There's also several opportunities to share your healthcare story, and I'll tell you, personal stories really do make a difference. They are really powerful. And I mean, I know the personal story I have about getting involved in this work because my mom had breast cancer and didn't have insurance. I know is a very, you know, it actually brings people in and it puts a human face on what's going on. So you can share your healthcare story. The Poor People's Campaign And LACE NC is looking for stories, and you can see that link right there. Also, our coalition, our other coalition partners, so Poor People's Campaign is one of our coalition partners, our Healthcare Justice North Carolina, amazing group out of Charlotte. They are also collecting stories and have been actually putting out weekly video stories on their Facebook page, so you can submit there. You can also write a letter to the editor at your local newspaper, and Stacy worked really hard to put together a toolkit that really sort of lays out all these different things and how you can get more involved. And you can see the bit.ly down there, NCM4A toolkit. The last thing is, if anyone has any announcements or stories that they want to share right now, you can either raise your hand or put in the chat that you want to make an announcement. We just wanted to open this part up for any organizations or people that are on this call that want to promote stuff that they're doing around around justice issues. And that's it.
Well, want to give folks at least 90 seconds to raise their hands if they have something to share before we say goodnight.
Yeah, can you hear me?
Yes.
Yeah, yeah, thank you so much, Rebecca. Thank you, George. Thank you, everybody. That was a powerful presentation, and I'm going to be really spreading out to our friends. Quickly, regarding Medicare, I work in the Black, Brown, Muslim community and refugee community, many of them working in meatpacking plants where there is a high COVID-19, no health care, and people are getting sick and dying. And it's such a huge issue that really want to bring the most impacted people, and honor to see Brother Dominic and UE150, that this is really a working class people's issue. And we need to bring in the most impacted people, organize them, build the power and their struggle. And Muslim for Social Justice is working on that front. And we're looking forward to working with you all to build that power, basically, against exploitative economic system, basically. So thank you so much.
Thanks, Mansoor. We lost a little bit of that. You were underscoring the importance, and that all of us who are on the call or part of this work can try to bring in impacted communities, folks that are part of your coalitions or part of your organizations that are likely to be dealing with healthcare disparities in their lives, a lack of access because of the system that exists. So try to expand our numbers by bringing in folks that you're working with as well. Thanks for all you do. Thanks for all that you will do. Good night. Bye. Y'all say bye back. I feel lonely.
Bye, everyone.
Thank you, George.
Thanks so much.
Thanks, everybody.
Bye.
Night. Thanks.
Bye.
Thank you.